A new procedure at University Medical Center gives patients an alternative to open heart surgery. It's called TAVR. And Dr. Pedro Cox, the director of the UMC Structural Heart Program, joins us along with Dr. Cox's patient, Eddie Slack. Thanks so much for being here.
Thank you for inviting us.
Yes. Well, first of all, Mr. Slack, the story starts with you because you were working in a garden, and tell us what happened.
I was working in the garden and I collapsed. I passed out. And my friend brought me to the hospital.
So you didn't have any symptoms, you just were walking around?
Walking around and bam, I fell on the ground.
Bam is a collective word. and Dr. Cox, what happened to him, you said, is heart failure?
Yeah, so basically he had one of the common symptoms of aortic stenosis. That's syncope. As well as syncope, you can have heart failure, you can have chest pain, and he collapsed, and that was his presentation for the condition.
Wow. Now you said you made it really simple a minute ago. You said the aorta has a door, and
yeah, so the aortic valve is basically, you have to think of it as a door between the heart and the rest of the body. When you have aortic stenosis, that door is halfway opened, and it's not letting blood go to the rest of your body, and you can have then the symptoms of heart failure, syncope, or chest pain, and then the condition is fatal.
Well, Mr. Slack, you are 70-something years old, and you haven't had any heart problems?
October the 12th, I'll be 77.
Wow. And you hadn't had any heart trouble before, right?
Nope.
So usually when you have this kind of condition at his age, open heart surgery is the only option, right?
Absolutely. As I mentioned, the condition is fatal, and you need to get treatment. For many years, we have been doing open heart surgery for these patients. But nowadays, we have other procedures that we can do less invasively.
Let's talk about that. It's called TAVR, right?
TAVR, yes.
TAVR, and it involves sort of the same thing as, I guess, a balloon angioplasty, but with something much bigger.
Yes.
Show us this thing. Hold this up and tell us what this is.
So this is basically the valve, and it's a really small valve that it gets collapsed so that it can go either from the groin. Mostly 90% of our patients will go from the groin, and then we'll go through the artery, and we're able to put this stented valve in the aortic valve position, then basically relieving the obstruction in the aortic valve.
So you put it in, and then you open it up inside the valve.
That's correct.
And that's what happened with you, Mr. Slack. Normally it would take open heart surgery patients how long to recover, doctor?
At least 5 to 6 days in the hospital.
Okay. For you, Mr. Slack, when were you up and around?
I was up and around and gone the next day.
The next day?
Yes.
So how do you feel? I should not even ask you how you feel the way you're grinning.
God. Thanks to Dr. Cox. Ooh, you saved my life.
Thank you, sir.
I'll never forget you. I'm indebted to you.
Right.
And God gonna be good to you too.
Thank you.
Because I talk about you all the time, everywhere. I tell everybody about you.
Well, he feels awesome, you can tell that. And like you said, most people, this is a fatal attack.
Absolutely. Aortic stenosis is a fatal condition. We do need to understand that. We diagnose around 5 million people with aortic stenosis each year in the United States, and we need to be aware, right, that when the patient starts developing symptoms of heart failure, they collapse, they have chest pain, they need to see their doctor, and they need to get evaluated for aortic stenosis.
Well, I'm so glad to know that there's an option here for folks like you, and I'm so glad you're here.
Yeah, I'm glad to be here.
I bet
Thanks
you are.
to Dr. Cox.
That's right. Well, Eddie Slack, you keep doing well.
Yes,
Dr. Cox, you keep saving lives.
Thank you.
All right. Thank you for being here.
Thank you for inviting us.
All right. Well, we're following some breaking news right now as Nikki Haley resigns as the U.S. ambassador to the United Nations. Haley served as governor of South Carolina from 2011 to 2017, the first woman and Indian American to serve as governor in that state, the second Indian American governor after Bobby Jindal, who served as Louisiana's governor, you remember. Fox News has confirmed President Trump accepted Nikki Haley's resignation as UN ambassador. It's unclear why she resigned. She's expected to meet with Trump shortly. We will bring you more information on this resignation as we get it. Well, a sweet little neighborhood puts on a festival just for people with a sweet tooth. We're going to the Fox 8 kitchen next.